Cannabis use has become increasingly common among patients seeking orthopedic care, whether for pain relief, sleep issues, anxiety, or simply recreational purposes. As laws around cannabis have relaxed, more adults, including those with musculoskeletal injuries, are using these products. This trend presents new challenges for orthopedic surgeons, who must consider how cannabis might affect bone healing, pain management, and the risk of complications after surgery. Endocannabinoid system, which is influenced by cannabis, plays a role in pain, inflammation, and bone metabolism. But the big question remains, does cannabis help or hinder recovery after orthopedic procedures? In this video, we'll explore the latest evidence on how cannabis exposure impacts fracture healing, opioid requirements, and overall clinical outcomes in orthopedic surgery, providing practical insights for both clinicians and patients. Let's dive into what research tells us about cannabis and bone health. Experimental studies in animals show that the endocannabinoid system can influence how bones form and heal. For example, cannabidiol, component of cannabis, may actually enhance fracture repair, while smoked cannabis can impair bone healing in some animal models. In humans, heavy cannabis use has been linked to lower bone mineral density and a higher risk of fracture. Some clinical studies suggest that cannabis users, especially those who also use tobacco, may face increased risks of infection, malunion, or nonunion after fractures. However, when researchers separate cannabis-only users from those who also smoke tobacco, the risks often appear lower for cannabis alone. This highlights the importance of considering other lifestyle factors. Overall, while heavy or inhaled cannabis use may pose risks, the evidence is mixed, and more research is needed to clarify these effects. Many patients turn to cannabis hopping. It will help manage pain and reduce their need for opioids after surgery. However, current evidence paints a more complex picture. Studies show that chronic cannabis users often report higher pain scores and actually consume more opioids after orthopedic procedures compared to non-users. While some small trials of pharmaceutical cannabinoids suggest modest reductions in opioid use, these effects have not translated into meaningful clinical benefits for most patients. In fact, the perception that cannabis reduces pain may be influenced by its mood-altering effects rather than true analgesia. For now, experts recommend focusing on proven multimodal pain management strategies, like regional anesthesia, acetaminophen, and nonsteroidal anti-inflammatory drugs, rather than relying on cannabis as a primary tool for pain control in orthopedic surgery. Beyond pain and bone healing, cannabis use has been studied for its impact on surgical complications. Some large studies link cannabis use, especially when combined with tobacco or other substances, to higher rates of infection, cardiovascular events, and readmissions after orthopedic surgery. However, when researchers adjust for confounding factors, the risks associated with cannabis alone often decrease. Clinicians, the key is to screen patients for cannabis and other substance use, counsel them on the risks of inhaled products around the time of surgery, and focus on optimizing all modifiable risk factors. Elective surgery should be postponed in patients with acute intoxication, and heavy users may need closer follow-up. Ultimately, shared decision-making and transparent communication help align expectations and support better outcomes. Summary: cannabis use is common among orthopedic patients and has complex, sometimes conflicting effects on bone healing, pain management, and surgical outcomes. Current evidence does not support routine perioperative cannabis use to reduce opioid requirements, and heavy or inhaled use may increase certain risks. Orthopedic teams should prioritize thorough screening, patient counseling, and validated multimodal analgesic strategies. As research continues to evolve, future studies should focus on better characterizing cannabis exposure, distinguishing between different patterns of use, and clarifying the true impact on orthopedic outcomes. Until then, clinicians and patients should work together to make informed, individualized decisions about cannabis use in the context of orthopedic care.